Uncle Dave lives 30 kilometres away from Goondir Health Services Dalby, which is an Aboriginal and Torres Strait Islander community-controlled health service, providing GP services to Indigenous clients in their service region. Uncle Dave is a local farm worker who feels socially isolated, has limited family supports, has multiple health conditions that go unmanaged, and he cannot take time off work. Uncle Dave is worried about losing his job and stresses about money to pay his bills because of the ongoing drought. Uncle Dave should attend Goondir at least 5 times a year for his health conditions, but has a number of competing priorities and usually doesn't make his appointments. Uncle Dave is a smoker and has a few beers after work to relax and distract himself from his stresses. Uncle Dave feels worn out, worries about everything going on, and is having trouble sleeping. Uncle Dave starts to feel pains in his chest, and his daughter drives him to the nearest hospital emergency department. Uncle Dave is assessed and driven to Toowoomba Hospital via ambulance for special treatment, 140 kilometres away from where he lives. Uncle Dave gets to the hospital and has no clothes, no wallet or ID, and his daughter is unable to travel with him because she has nowhere to stay in Toowoomba. Uncle Dave feels better the next day and is worried about losing his job, so he contacts his daughter to drive to Toowoomba and pick him up. Uncle Dave discharges against medical advice and has no medication or follow-up care plans to continue his medical treatment. Uncle Dave feels sick on the way home, and his daughter takes him back to the nearest hospital emergency department, and again Uncle Dave is driven back to Toowoomba Hospital. After 3 days in hospital, Uncle Dave feels uncomfortable in an unfamiliar environment and doesn't know anyone other than the Indigenous Liaison Officer who has been to visit him. Uncle Dave has had a number of different staff provide care for him during his admission. Uncle Dave is now feeling confused about the information being provided, plans for his medical treatment, and feels that no one is listening to him when he asks questions. Uncle Dave's sister visits him in the hospital and offers to take him home. Uncle Dave discharges against medical advice a second time. Once home for a couple of days, Uncle Dave becomes unwell and is taken to hospital again by an ambulance. After being admitted to hospital, this time Uncle Dave completes his hospital admission and receives the care and medical treatment that he requires. During his stay in hospital, he has been put on a new medication and has received referrals to hospital-based allied health services for his medical condition. Through these admissions, Uncle Dave's GP at Goondir was unaware that Uncle Dave had been in hospital and did not attend his scheduled appointments with his GP at Goondir. Uncle Dave's GP is also unaware that his medication has been changed by a specialist during his admission to hospital, nor is he aware of the test results that had been taken at the hospital. Additionally, Goondir is unaware that a post-discharge appointment has been arranged with Uncle Dave's specialist back in Toowoomba Hospital. To make matters worse, Goondir receives a discharge summary 5 weeks after Uncle Dave has been discharged, and he has not attended the Goondir clinic since his admission to hospital. Uncle Dave failed to attend his post-admission appointments with his specialist in Toowoomba and cannot be contacted to rebook another appointment. Uncle Dave returns to work feeling better after his treatment in hospital, so he puts off going to Goondir until he feels sick again and needs a new prescription for his medication. What if we have a solution? What if Goondir and Darling Downs Health can support our communities to access healthcare in our own homes, rather than waiting for appointments or travelling for appointments? What if we, Goondir and Darling Downs Health, can support patients in a primary health care as well as in the hospital? What if patients only need to tell their story once, and Goondir and Darling Downs Health can collaborate to coordinate seamless patient care, reducing the need to travel for specialist appointments and hospital admissions? What if we can support our communities to steer their own health journey and reach their full health potential? What if we can partner with Telstra Purple to bring health innovation to our communities? What if we partner with the University of Queensland to research the solution to see if working together using digital innovation improves health outcomes to our communities? We present to you the Inreach Project. Now, Uncle Dave can access GP services by phone or tablet provided to him by Goondir at no cost. This is what we call virtual health services. This only gets better. Uncle Dave's vital signs will be monitored and managed by BP machine, glucometer, pulse oximeter and weighing scale, all Bluetooth enabled. Uncle Dave's results will be recorded on his tablet and sent to Goondir Clinic. A virtual health services manager will monitor Uncle Dave's results. If the virtual health services manager receives any abnormal results, Goondir will arrange an appointment to see Uncle Dave. Even if Uncle Dave books an appointment himself, any part of his historic results can be used by his GP to help determine Uncle Dave's diagnosis. To ensure Uncle Dave is comfortable with the new technology, Uncle Dave will be supported by a health coach. The health coach will work with Uncle Dave to help him understand how to use a telemonitoring unit to record his vital signs and send the results to the virtual health services manager using the tablet provided to Uncle Dave. The health coach will also work with Uncle Dave to assess his lifestyle choices, and together they can work on improving Uncle Dave's medical conditions through health education. The health coach will help Uncle Dave to understand what his medical conditions are and ways by which he can manage his medical conditions. If Uncle Dave is hospitalised again for his condition, Uncle Dave will be in a better position to discuss his condition and treatment with the hospital staff and confidently raise concerns if he does not agree with any advice. But wait, there's more. If Uncle Dave needs to go to hospital, Goondir's and Darling Downs Health Interagency Liaison Officers play a critical role in collaborating and facilitating a seamless patient journey through Uncle Dave's admission, inpatient stay and discharge back into Goondir's care. This coordinated model of care will also include information sharing of Uncle Dave's health history and improved timeliness of discharge summaries. Uncle Dave's care team at Goondir can be involved in discharge planning through telehealth, and his family can check in with him using his tablet provided by Goondir. This prevents Uncle Dave's family having to drive all the way to Toowoomba to visit him. The Inreach also ensures Uncle Dave is familiar with the staff working in the hospital, as he will have met them in the Goondir clinic. The Inreach project will also allow Goondir staff to spend time learning the hospital system and processes and vice versa. The Darling Downs Health staff will spend time learning and understanding Goondir's primary health model of care. This shared understanding by Goondir and Darling Downs Health staff, knowing how each other's health systems function, will assist the navigation of Uncle Dave's journey between both health systems. To avoid any potential discharge against medical advice, Uncle Dave can consult with the interagency liaison officers who will advocate on behalf of Uncle Dave for an early discharge with the treating team. If Uncle Dave meets the early discharge with medical advice criteria developed by Darling Downs Health, Uncle Dave is provided with discharge medication, a discharge summary, referrals to follow-up appointments, and his GP at Goondir is notified of the treatment plan. Project Inreach not only removes barriers from the current complex healthcare system, but supports clients with their journey between primary, secondary and tertiary healthcare services. The ideal outcome of the Inreach project is improved cultural and social supports, streamlined health pathways, optimizing existing health services, and having a smooth client handover that is patient-centric across two complex systems. Therefore, increasing patient satisfaction and experience in order to reduce potentially preventable hospitalizations and hospital readmissions. Project Inreach proposes to be an exemplar for ensuring the patient is at the centre of all care no matter where they are in their health journey. Through research, this project will demonstrate that there will be better health outcomes for the patient because there is a seamless patient journey between the primary and public health systems.